What drugs should you avoid with ulcer bleeding? If you or someone you know has experienced ulcer bleeding, understanding which medications to avoid is crucial for safety and healing. Peptic ulcer disease involves sores in the stomach or upper small intestine lining, often caused by infections or certain medications. When bleeding occurs, it's vital to prevent further injury by steering clear of drugs that can worsen the situation. One of the main culprits is nonsteroidal anti-inflammatory drugs, or NSAIDs. These include common pain relievers like ibuprofen, naproxen, and even over-the-counter aspirin. NSAIDs work by blocking enzymes that reduce inflammation, but they also decrease protective substances in the stomach lining. This makes the stomach more vulnerable to acid and injury, increasing the risk of ulcers and bleeding. Even short-term use of NSAIDs can cause problems, especially if you already have a history of ulcers. If you need pain relief, acetaminophen is generally safer, but always check with your healthcare provider first. Aspirin, especially in low doses used for heart protection, can irritate the stomach lining and increase bleeding risk. Other antiplatelet medications like clopidogrel also pose a bleeding risk. If you need these drugs for heart health, your doctor might recommend combining them with medications that reduce stomach acid, such as proton pump inhibitors, to help protect your stomach. Never stop these medications without medical advice, as that could be dangerous. Corticosteroids like prednisone are sometimes prescribed for inflammation. When used alone, they may slightly raise the risk of ulcers, but the risk becomes much higher if combined with NSAIDs. If you have a history of ulcer bleeding, discuss the risks with your doctor before starting corticosteroids. Blood thinners, including warfarin and newer drugs like rivaroxaban and dabigatran, are used to prevent blood clots. These medications can significantly increase the risk of gastrointestinal bleeding. If you are on blood thinners and have a history of ulcers, your doctor will carefully weigh the benefits and risks. Sometimes, doses are adjusted or temporarily paused, but only under medical supervision. Some antidepressants called selective serotonin reuptake inhibitors, or SSRIs, may slightly increase bleeding risk, especially if taken with NSAIDs. If you are on an SSRI and have had ulcer bleeding before, inform your healthcare provider. Practically speaking, if you have peptic ulcer disease, always tell your healthcare team about your condition before starting any new medication. Avoid over-the-counter NSAIDs and aspirin unless your doctor says it's safe. Lifestyle factors like smoking and drinking alcohol can also worsen ulcers and should be minimized. If you notice symptoms like vomiting blood, black or tarry stools, or sudden severe abdominal pain, seek emergency care immediately. Treatment often involves medications that reduce stomach acid, antibiotics if infection is involved, and sometimes procedures to stop bleeding. Regular follow-up with your healthcare provider is essential to monitor healing and adjust medications as needed. Remember, managing medications with ulcer bleeding is complex and highly individual. Always follow your doctor's advice and never make changes without consulting them. This information aims to inform and empower you but is not a substitute for personalized medical guidance. If you have concerns or symptoms, contact your healthcare provider promptly to ensure safe and effective care.